All right, so day one post-op, one of the best things you can do is breathe. You're not gonna feel like doing a whole much else, which is fine because your body needs to recover, but you can breathe. So when you're lying in the bed, probably propped up a bit on pillows, you're gonna start doing your breathing. And I'm gonna show you what it should look like. And now just pretend, because I'm not gonna be propped up, okay? So you can bend your knees. Sometimes that will feel better once they do their incisions here anyway. And you want to focus on slow, deep breaths, okay? So watch the hand that's on my belly and watch the hand that's on my chest. And you'll notice that this hand is moving more than this hand, okay? Ready? Now every time I inhale, I want my ribs to expand just a bit, okay? So you can see my hands moving there. And you can see my belly gently rising as I inhale and falling as I exhale. This is pretty quiet up here. It might be difficult right after surgery because you're gonna have the 4 incisions and you're gonna have that pain in your shoulder. So it's gonna feel weird and it's gonna feel hard to take a nice deep breath. But even if you make them small, you're still getting benefits, okay? You're getting your belly moving, which is gonna help the abdominal wall keep moving, plus your pelvic floor is moving and your diaphragm is moving, your ribs are expanding. So it's really important, that is step 1, that you can do as soon as you get home and you feel like you're with it enough, you can start your breathing. Now, later that day or into the next day, you can start to activate your deep core muscles, okay? I'm gonna show you sitting up, because I think it might be a little bit easier to see, and then I'll come down to. So deep to your rectus abdominis, deep to your internal and external obliques, you have transversus abdominis, okay? It is your deepest core muscle, and it basically draws everything in. So let me show you from this side. I hope you're not offended by my belly. I'm gonna go with you're not, but if you are, just delete the video and okay. So when I'm relaxed and breathing, my belly expands as I inhale, my ribs expand as I exhale, everything draws in. So I'm gonna use that exhale to help activate my deep abdominal muscles. And when I do that, inhale to prepare, exhale, my belly flattens, okay? Everything gently draws in. Now, I am not trying to get my belly button to my spine. That is not the same thing. That is not a super functional movement for you, especially right now. I am thinking about what would happen if I could bring my hip bones closer together. What would that feel like? Or if I had a button down here and I needed to button my button, and I just ate Thanksgiving dinner, how can I draw my belly away from the button? So it's nice, it's a nice flattening of the belly. The TA muscle, the muscle that we're doing, really, it just acts as a corset. It hugs everything in. So if you think back to when you were pregnant, if you had a baby and you could give it a little hug, that's the motion. It's a very small movement, and so that's okay, because that's all you really need right now. Just that small movement to kind of remind it of what it's supposed to be doing. If you would like to throw a Kegel in there, that is a squeeze and lift of the pelvic floor. You can imagine that you're drinking a vagina smoothie and your lips have to close around the straw, and then you pull the smoothie up and in. I will show you. So here I am sitting crisscross applesauce, which is not the best position to do a Kegel in, but I'm using my exhale to draw my pelvic floor up and in as if it's an elevator, and I could shut the elevator doors and lift it up to the 3rd floor, as well as gently drawing that deep abdominal muscle in. And now, if I hadn't told you what I was doing, and if you didn't hear me breathing, it wouldn't look like a whole lot. Okay, so these are things that you can do in the bed. Very small efforts, don't overdo it, but breathing and activating those deep core muscles is absolutely fine and safe. There's no reason for you not to do it. Also remember, when you're getting out of bed, do not do this number. You're not gonna be able to do that the first couple of days. You want to breathe out as you roll over, drop your knees over the edge of the bed, and then you'll have somebody helping you the first couple of days. But when you feel ready, you're going to use your exhale to help you push up. You're drawing your belly in, you're lifting your pelvic floor as you push up on the effort. You are exhaling on the effort with everything that you're doing this week, okay? Let me know what other questions you have. And I just thought this would be easier than sending you the little sheets, because sometimes you just need to see it. So there are your post-op instructions from the PT standpoint. So yeah, okay. Let me know what questions you have. All right, bye.